This is the left pelvis of an adult individual, also called the innominate. And this is made up of 3 different bones that fuse together during development. So we have this bit here, which is the ilium. So the ilium from medial view, and then from lateral view. Inferiorly, we have the ischium. This is the ischium anteriorly, posteriorly, and then kind of from the medial side. And then at the front of the bone, we have the pubis, which is this section here. So this is the pubis viewed posteriorly, medially, and then anteriorly. So we'll start off with the landmarks on the ilium. So you're probably already familiar with the auricular surface, which is this bit on the posterior side, posterior medial side here. So this forms the articulation with the sacrum. So this is one of the sacro-iliac joints. That's your auricular surface. And then running from the most anterior point, so this bit here of the auricular surface, sort of along this portion of the bone, sort of out to the top of the pubis. This is the arcuate line. And this is, if you imagine drawing a line sort of across the bone, this separates what's called the false pelvis, so this portion of the ilium up here, from the true pelvis, which is this part of the pelvis, made up mostly of the ischium and the pubis. So I'll just try and set that down. So this part of the ilium, the bit along the top, this is called the iliac crest. And there are a few different landmarks on the iliac crest. So starting down here at the back, so this part, so we're on the auricular surface, so this is the posterior inferior iliac spine. And if we just hop to the other side of the auricular surface here, this is the posterior superior iliac spine. And then if we come all the way around to the front, this projection here is the anterior superior iliac spine. And then this bit here, this is the anterior inferior iliac spine. So they're all iliac spines, but we have anterior inferior, anterior superior, posterior superior, and posterior inferior. And then we have this section of the ilium here, so it's sort of superior and posterior to the auricular surface, and it's this roughened area of muscle attachments. This is called the iliac tuberosity. And then if we look to the main part of the ilium, when we're looking at it medially, this area here, it's kind of concave, the surface of it. This is called the iliac fossa. And in some individuals, like we see in this individual, the bone can be really, really thin, so it's practically see-through. But that's just normal variation, that's absolutely fine. So that's the iliac fossa. Other points to note here, so I'm sure you're already familiar with this. So this is this great big scoop of bone, which sort of starts up on the ilium and then sweeps down towards the ischium. This is the greater sciatic notch, used as a sex estimation feature. And then this point that it ends in, sort of ridge, this is called the ischial spine. And then inferior to the ischial spine, we have another little cutaway notch just like we did, well, almost like we did with the greater sciatic notch. This is the lesser sciatic notch. So you've got two sciatic notches, lesser and greater, separated by the ischial spine, or spine of the ischium if you prefer. Other features of the ischium, it's mainly this great big rough area here, which is the ischial tuberosity. So this is the bony part of the pelvis that we sit on when we sit down. So it's all this area here is the ischial tuberosity. And then obviously this feature stands out as well, this hole sort of between the three different bones. This is called the obturator foramen. So there we have it posteriorly, and the view from the anterior side. Oh, and then of course we've got the acetabulum. So this great big joint surface for the head of the femur. And the acetabulum has parts that belong to the ilium, the ischium, and the pubis. But obviously in an adult, they're fused into one piece of bone, and you wouldn't be able to see any of the joints between them. So over on the pubis now, you'll already know the pubic symphysis. So this is the cartilaginous joint that will articulate with the other side of the pelvis. And then just superiorly and anteriorly for that, so this bump here, this little bulge of bone, this is the pubic tubercle. This individual also has an extra little nubbin of bone, which is not the pubic tubercle, but it's sort of like an extra little ridge. And then we have these two sort of bridges of bone that connect the pubis to the ilium and to the ischium. So bridges of bone one is always called a ramus, or rami is the plural. So the one at the top is the superior pubic ramus, but this is also called the iliopubic ramus because it's joining the ilium to the pubic bone. And then the lower one is the inferior pubic ramus, but you can also call it the ischiopubic ramus as well. So that's our adult pelvis.